Hello and welcome back to the Out of Programme podcast. Today we are joined by Dr Zahra Safarfashandi, a doctor who made the transition early in her career into consulting. She is now a partner at Carnall Farrar, a specialist consultancy focused on the healthcare and life sciences, where she now leads their work in the Middle East. Hello Zahra, welcome to the show.
Hello, lovely to be with you. How you doing?
Great, thank you. So let's start from the beginning then. What got you into medicine?
I think like many young people in school, I wasn't entirely sure what I wanted to do. I had a lot of family of doctors. My sister was a doctor and I thought I'll be a doctor or a lawyer. So I jumped into medicine and I really loved it. But I guess there wasn't that much thought process at 18. It was more, what do I have an aptitude for? I quite like people. I quite like science. So I gave it a go.
Did you feel like there was a lot of family pressure, or was it active, or was it just a subtle passive influence?
I don't think so. I think my dad was an engineer and my mum was a teacher. So there was no real push into medicine. It was just trying to figure out what was the right path for me. And I think at that age, you haven't heard about so many careers. You haven't heard about, I'd never heard of consulting. I didn't even know it was a thing. And so for me, it was very traditional pathways that I was exposed to. And so I just kind of picked the one that felt right. My sister, now a consultant surgeon, like absolutely loved it. She loved the surgery, treating people, saving lives and all of that. And so there was a lot of positivity around it. I had an uncle who was a consultant pediatrician, stories about saving people, making a real impact. And so I thought, I'd love to do that. And it sounds like a really rewarding pathway. So there wasn't really that push. I think I just jumped in with what seemed logical at the time. And maybe if I had been exposed to AI and tech and all that sort of thing, maybe I would have taken a different path. But at that point, medicine seemed cool.
Brilliant. And how was your experience then as a medical student? Did you enjoy it, or were you already thinking about different things?
I really loved medical school. I think I loved being in London at Imperial, where we went together, which was good fun.
Yes.
I think London medical schools are a different kettle of fish. It's a very different experience. It's less campus focused and more London focused, which creates a great student life experience. I think the medical school itself, I made friends for life, some really brilliant people. And I think part of your experience is about who you surround yourself with, the things you do together. And the training was outstanding. So we went to Imperial. And I think the training there is second to none. The things you're exposed to, the bright minds who are teaching you every day, they're quirky, but they're some of the most brilliant people. And so you get such a fantastic experience. And we were put out into hospitals. We did our first program with patients. I think in our first year, we went to visit people in their houses, and that was scary, but also really exciting. And so for me, I absolutely loved it. I found it got less exciting over time because in medicine, I feel you learn similar concepts repeatedly, and maybe that's the right way to reinforce the learnings. But at the start, what was very new and very exciting became less new and less exciting as you went over time. And I think in that fourth year, we did a really cool intercalated degree, and that's probably what led me astray away from medicine. Was entering the Imperial Business School and seeing there was a whole world of concepts I'd never come across before, but that fit me a little bit better. And so I think the last couple of years of medical school, after I'd been exposed to that in year 4, were more challenging because my heart started to drift elsewhere and started to be more focused on business and economics and how to have impact in that space than it was on learning the care protocols and how to kind of connect with those.
So I think you pointed out there that you and I met actually at Imperial. And I think what was interesting for me as someone who did 3 years in Oxford and then I transitioned over for my clinical years in Imperial was just how different the students were. And you made a really interesting point there about... yeah. Oh, yeah, of course. But I think you make a really interesting point there about, being in London. Did you feel like actually being exposed to, I guess, London, which is a melting pot and, a financial hub and also a startup epicenter, and also being linked to a university that has a strong background in STEM subjects, did that also inspire you, or was that not something that you thought about at the time?
I don't think I thought about it at the time, but I think Imperial was a fantastic fit for me personally. I think I had probably not the most mature approach to picking university, which was I didn't want to leave the M25. I went to school at M25. I've always lived within the M25. So, I hadn't been exposed to much of the UK, and I found the idea of going somewhere else daunting. And so when I look at my list of applications, it was 90% in London, and here's my safety school. I think I even had safety schools in London. And so If I was to do it now, I'd probably be looking for something a bit different to kind of broaden myself. I have friends who applied to international schools. They went to great places in Europe. They went to the States, and actually their experience has been brilliant. I was just not ready at 18 to make that kind of bold decision. And having gone straight into medicine rather than grad med, perhaps at grad med, you're a bit more mature, you're ready for those choices. I think I just picked the schools that felt very close to home and very comfortable. And I was lucky that Imperial took me, and it was a really good fit. And this focus on STEM and the whole culture of the place just really worked for me. I think it was great to have the grad meds join us from different schools, because I think they created new levels of competition, which probably pushed us all to achieve greater things, because they're very competitive, the Oxbridge lot, as you will know better than I will. But I think, the injection of new people, new experiences, new ways of doing things was really good for us, because you can become a bit siloed and narrow in your approach. But I think at 18, it was a good place for me, and I love it. And I spend a lot of time at Imperial still. So I think I've probably made that connection for life. But maybe if I was to do another degree, I would branch out a little bit and go to somewhere cool.
That's really funny that you said that the Oxbridge grads that came in pushed you guys, because I certainly felt that when I arrived to Imperial, the Imperial medical students were just built differently. I was encountering students that had, more publications than some primary investigators from Oxford. People are smart and academic, but they're not the kind of hustlers that I came across in Imperial. You had people who were already well on their career path, academically or entrepreneurially or business-wise. So it's funny to hear that alternative perspective.
Yeah, that's a hilarious perspective. I had no idea you would think that way about I think there's a perception difference from whichever side you're on, and over time we sort of melded. But I think it was good. I think it was good to challenge each other. But you're right. I remember, you and I will probably remember someone who we interviewed to take over from us from a society we started, and it was an analyst with publications who wanted to talk to us about how to get even more publications. So I think they're definitely a bright bunch at Imperial that continue to push the boundaries of academic achievements, which is pretty cool.
Yeah. Imperial definitely gave me a taste for publications, that's for sure. And just going back a little bit, you mentioned that you started having a change of heart once you pursued your intercalation. So what was it about the business school intercalation that made you think differently?
I think it just exposed me to something really different that I just never had the chance to come across. So we did things like health economics, like business cases. It was all grounded in healthcare, but I think it was called healthcare management within the business school. So it was all about how to be a healthcare leader, how to do kind of transformation. What are the challenges within health and how can you address them? Which up until that point, the focus had been on clinical transformation, clinical care, and was just one aspect of what needed to change. And I was exciting to think about what could we do and how you could approach that. And it was a part of medicine I'd never really seen before or been exposed to before. I'd never had anyone who was a consultant in that way in my life. And so it was just a lot of fun. We had really fun simulation modeling where we owned a business, and they gave you a budget and you had to do things and there were consequences for your decisions. And it was so competitive and so much fun. And it was just a completely different world, learning how to do health economic modeling, learning how you price drugs, what drugs get accepted into the NHS, which ones don't, and what the rationale is, how to create a case for those things. All of these things were just such fascinating concepts that I don't think you get through traditional medical education, but are obviously core to how a hospital runs, how a healthcare system runs. And that's the stuff I just found so fascinating. And so at that moment, I realized that I had only had an incomplete picture of what it meant to be a clinical leader or a healthcare leader. And so that was exciting to me, and it lit a bit of a fire. And that fire just didn't go out over the last couple of years of medicine. I found myself constantly thinking about it. I continued to engage with the business school, leading projects, doing interesting things whilst completing medicine. And that's when I started to get exposed to consulting, and I started to apply for projects and other things to kind of get more and more exposure.
So can we zoom in a little bit there? Because you mentioned that you did your intercalation, but then you remained attached to the business school and carried on doing projects. So what did that look like?
Through that intercalated degree, you do some projects. So I did mine with Lord Aradazi, and we thought about a medically patients on ventilators, how they can't really communicate. And we developed an app that was to help people to communicate when in that ICU setting. And it was very exciting. And we, created the technology, and we wanted to get investment, and we wanted to sell it. And it was a nice concept. We obviously went for a series of publications.
Of course.
But we wanted to keep that momentum going. There were lots of little things like that. I loved what I did at the business school. And so I've stayed really close to the faculty. I have mentored people through that program. I've taken in both my consulting firms, I've taken students through those projects onto placements in the companies I've worked in to give them exposure. So I've really created that lifelong connection with that Imperial Business School. I think what they do is brilliant and I really loved it. And so I try to give that back, and I always have throughout my journey, to kind of give other students the opportunity to get what I did when I was there.
So you mentioned consulting there, and of course you transitioned into a non-clinical role pretty early on in your career. Can you walk me through how you thought about things? How did you arrive to the conclusion that you wanted to pursue consulting?
It's an interesting one. It was a tough decision at the time, probably tougher for my family than anyone else, because I think by that point my dad was very attached to me being a doctor and he had no idea what this consulting malarkey was, and he wasn't having it, but he came around. So it was a big decision and a big moment, because you've worked for such a long time to achieve that, and you have this picture in your head about, walking the wards, looking after patients in the hospital. I think a lot of people just think about hospitals when they think about med school, probably not quite the way it works out. But I think I had a bit of the bug for consulting and I wanted to do projects. And I think for me, what I found really difficult is towards the end of medical school, you start to think about what's next for me. And I wanted to make a difference. There were so many challenges. There were so many people that I wanted to help. There was so much impact I wanted to have. And the more time I spent in medicine, the more I realized that there are lots of really fantastic, influential clinicians. Most of them are incredibly senior. Most of them have done their tenure, they've got their experience, and their voice and their thinking and their experience has real weight. But most people kind of affecting change are not young, bright F1s, F2s, even though they've got brilliant ideas and tons of energy. And I find myself looking at a career path that said I'd have to wait until I was really, really senior, reaching sort of the end part of the stage of my career before it would be my turn to be heard and listened to. And maybe that's not quite right. I'm sure there are loads of people who do manage to affect change, but the established pathway was not one that favoured the energy of youth and going after things when you're fresh into the job. And so for me, I was young, I was impatient, and I just wanted to set the world alight and make all these changes. And consulting was this thing that promised you on day one, if you come in, like, you will make a difference. And that's what it's delivered for me. So I've never looked back since switching, but it's a hard choice to make, and you have to be a bit brave. I think the thing that helped me was people saying you can always, it's not forever. If it doesn't work out, if you don't like it, try something different. And that kind of helped me just take the leap.
I think that's a really fair point about the impact. I think during medical school, we look at all these kind of senior figures. I mean, you mentioned Lord Aradarzi. I mean, that man has achieved so much across so many disciplines. Even if a single person were to achieve one pillar of the things that he has done, that would be a very fulfilling and substantial career. But certainly when you are just starting off as a foundation doctor, it can feel very far away. And I remember having the opportunity to present at a grand round once when I was a foundation doctor. And I thought, wouldn't it be fun to present something technology related, a mobile app project? And I remember giving this talk and there was just nothing but blank stares, no questions. The person who did their medicines audit got more engagement than my, mobile app solution. And I just thought to myself, gosh, they really don't know what to do with me. And there's just no platform for these kind of ideas. But as you say, things have changed a lot now. And I think innovation is far more at the forefront of things. But certainly at the time, there was an absolute dearth. So I think based on that analysis, I think it sounds like you made the right call.
Yeah, I'm pretty happy with it. I like that it's getting easier. I like that we're getting more diverse voices and we hear what the young people today want to do. Probably because we have a bit more of a burning platform around change needed with waiting lists, with the other challenges and funding in the NHS. Digital data, AI, it's all becoming core. It's all becoming very trendy. It's the saviour of the NHS. And that creates more of a platform. And so I think it's great that it's changing. I wish it had changed when maybe we'd both still be practicing clinicians, but we'll see.
What could have been? I just want to take a step back actually to something that you said, which was that you referenced that your family had kind of become quite wedded to the idea that you would become a doctor, so they needed a bit of convincing. I guess I wonder how that actually was, because I think many of the people who listen to this podcast will talk about the risk in making the leap into the unknown. And I think there's a huge amount of family pressure that pulls us, that creates that gravity to stay the course. My parents were first generation immigrants. And so, like many first generation immigrants, they wanted me to have a safe career. They took all the risks, so they didn't want me to. And when I was talking to them about, starting a business and building technology, they were really unsure. They never they never directly influenced, but I guess the way that they asked the questions, the way that they talked to me about it, you can tell that there was a lot of hesitance, and they really wanted me to just become some consultant professor because I felt very known, very respected, and very safe. Whereas startups, they had absolutely no idea. So how was that for you in actual terms? Like, was it a bit of a struggle, or actually it was fine and a bit of a joke?
I think you're right. Parents want what's best for you. And similarly, like consulting and other and startups, probably more so, it's not a known territory to them, and they just want what's best for you on a really steady, stable, well-respected path. And that's hard for them to give up on. My mum's always been my cheerleader, and I could tell her I want to become a Smurf and she'd be happy about it. She didn't take that much convincing. My dad is much more steady, thoughtful, and nervous of big changes. And so his counsel was, to stay with medicine, and it took a bit of time to convert him. I'm very fortunate in that they're never pushy, aggressive. They never try and make me. It's just coming from a place of we're nervous and we want to support you. But I know not everyone's as lucky. I think for me, taking a plunge into consulting was easier because consulting is one of the oldest professions. So whilst it's not medicine, and it took a while for people to learn what that is because we didn't have a lot of consultants in the family, there's still a lot of people around us, friends, other contacts that they could look to understand it a bit more. So it was slightly easier for me. I'm sure doing a tech startup was a lot scarier for your parents than consulting. I mean, it's all about the support network and being patient with them and them being patient with you. I think you just have to take time to explore it together and not get your back up and get stressed because people don't jump aboard, because it's not an easy decision to make for yourself. And whilst you might want decision, you also want counseling from people around you. You want the naysayers. You want people to tell you it's a bad idea, because that helps you to stress test, is this the right decision? And make sure you're really sure, because no career change is easy. It's never, greener on the other side. It's always about, it's hard. It takes a while. You have to learn new skills. And so I really value that check and challenge I got from the people around me, because ultimately I'm fortunate and they just wanted what was best for me, and it worked out well. And so I'm happy, but they caught many of my silly mistakes that I didn't pursue. I'm grateful for that kind of input from them.
I think that's a really good perspective. That idea that, yes, you're going to receive the challenge, but that is actually, the litmus test for whether or not you are actually committed. Definitely. So then let's talk a bit more about consulting. So you transitioned from medicine into this completely new field, and I believe you started off in Deloitte. So can you walk me through what that was like, starting your first role in consulting?
Yeah, definitely. So it wasn't an easy choice. I wasn't sure that anyone would have me because it was a completely different field. I didn't know if I was qualified. So I basically applied to every firm you could possibly apply to, until one of my coaches at the time told me to stop because it was excessive, which I'm very glad that they did. And thankfully, you realise very early on that being an Imperial trained medic is actually quite useful. And so most of those places were happy to give me a place. And I started on one of the graduate programs because I recognised I didn't have a lot of experience. I didn't really know what I was doing. And so didn't want an experienced higher position. I wanted to start from the beginning because you get more training. One of the challenges I came up against is none of the big firms, and I only really applied to big firms at that stage, brands I'd heard of, wanted to specialise straight away. So no one was really interested in me doing healthcare. They wanted me to broaden myself, to go into banking or some other sector. And I was stubborn, and I'd convinced myself that I wanted to do healthcare consulting. That's why I'd left medicine, was to focus on healthcare challenges, not generic ones. And so Deloitte, I'm really grateful, was the only place that as an analyst let me specialize. And it's really unusual. And it was a few really great leaders taking a chance on me. And so that's why I jumped aboard. I think it was more about those specific leaders than it was about the particular firm. And I'm sure you could get that in any of the firms, but it let me do the thing that I wanted to do straight away and start having that impact. Day one, they put me talking to a board at a very large London trust, and it was terrifying. And they say whatever you want to say, just bring your opinion into the room. And I did. And the trust CEO was listening to me, and the board was listening to me, and they were taking my ideas. And so it was like such a surreal experience. Literally day one. I'm not sure necessarily it should have been day one, but that's what happened. And I remember leaving the room on my first day on that first project, feeling on top of the world. I'd done this wonderful board meeting and they'd actually listened to my ideas and it was so exciting. And one of my colleagues who I used to work with was running down the hallway to A&E. And I was like, gosh, 2 days ago, like we were the same person and you're so frantic and so stressed. And I've just come out of a board meeting with your trust chief executive. And it was just a really surreal moment. And I think it was the perfect day one. I think it was a very unique experience that has never replicated itself, which probably but it was a really fun way to start, and so I'm really grateful.
Yeah, it sounds like a brilliant baptism of fire and really exemplified what you were saying earlier about making impact at your level. So then in that role, was it what you expected, or were there things that you kind of realized along the way that actually you didn't enjoy?
I think obviously I left Deloitte, and whilst it was a great place to start my career, it wasn't quite the right fit for me, and I learned that over time. I think it was a great place to start. Really good skills. It's a big, very traditional consultancy. And so there's a lot of training, there's a lot of development, there's a great peer network. I think I joined with 1,000 other analysts or something surreal like that. And so you had great support and a network around you. And so those first couple of years were, fantastic. I think what I learned over time is I love healthcare. And so whilst they had a healthcare team, they also had teams doing lots of other things. And so it was more of a general type of consulting. And I felt like I wanted to learn about health. I wanted to be the best in healthcare. I wanted to know, I wanted to learn from leaders in the healthcare system. I wanted genuine expertise. Apologies, my cat is trying to join this podcast. So, for me, that's what drove the change. It's traditionally started as an audit firm, I think, the big four consultancies. And so they're more about, finances and making the books balance. And whilst that's really important, I really wanted to be around just people who've had a whole career in healthcare and could teach me exciting things. And so whilst there were some absolutely fantastic healthcare leaders there, that wasn't the primary focus of the whole firm. And so over time, I wanted to shift and I wanted to find a place that was expert in healthcare. It's what everyone was passionate about. It's what everyone cared about. We could debate healthcare concepts until the health came home. And so that's why I was looking for a change. And I think I got the great generic skills from Deloitte. And I'm so grateful for that investment in my kind of early stages. But once I had that under my belt, then it was about, okay, I really want to be a specialist and I want people who care about what I care about to kind of go on that mission together.
Before we move on to that journey into Carnall Farrar, I just want to zoom in a bit more on the early days of that consulting journey. Did you find as a medic that it was easier or harder in some ways in joining that graduate program compared to your peers?
I think it was much easier to get a job than it should have been. I think people were very kind about a medical degree. And I think it's because it's a STEM degree. I'm sure there are other degrees that similarly find it slightly easier to access those jobs. But I think the way that you're trained, the method to it, the rigor, the hours that you're used to all set you up really well. So actually, I think it was much easier. And I used to refer to it as a bit of a ticket to get a job at that stage, which is, you're grateful for. It's not as easy these days to get a first job.
For sure.
It definitely helped. And I think I was put into situations as a medic that you wouldn't typically get put into. So that board meeting was an area I knew something about. And so just wouldn't get that. And so typically that's why many medics will come in as experienced hires. They won't start at the very beginning. And so against the peer level, like you have slightly more competence than you would have at a typical analyst level, which was great. And if you want to do healthcare, it levels you up even more. And so you can contribute more meaningfully to the actual subject matter that you're discussing. I think there were challenges how to put this, you have more subject matter behind you, but that also creates impatience, right? Because there are limits on grades and what you should be doing. And so you're slightly more ambitious, you're interfering in things that are slightly beyond your pay grade and beyond your level of responsibility. And that creates a tension point as well. And so I think that partially drove why I was looking for a place that everyone was focused on healthcare. And so it's sort of a bit tricky. I think you also get put into situations where they trust you have more subject matter knowledge, but I didn't know what a CCG was. And my first project was figuring out, finance CCGs. And I had to Google what is a CCG, but I've just been given this massive spreadsheet and just assumed knowledge. In medicine, nobody taught me what a CCG was. Nobody taught me about core healthcare concepts about how you actually run, how do you purchase things, what is a commissioner? All of that was new to me. And so whilst I knew a lot about the patient facing side of things, I knew nothing about how you actually run a hospital, how you run a healthcare system. And so there then become this mismatch of expectations as well. And you want to do well, but you you don't have some of the knowledge. And so it does put you in a bit of a funny situation. I think there's no right way to start. If you start more junior, you run into some of these problems. If you start as a more experienced hire, you don't have the cohort, you don't have the same type of training. There are really tough expectations from day one, but you wouldn't hit those same barriers. And so you have to sort of weigh it up. I always recommend, starting from the beginning if you can, because you get the chance to go at your own pace and then you can accelerate off that pathway quickly. But you have to do what feels right for you. And it probably links to how much experience you have in a clinical space before you make the switch.
I suppose reading between the lines here, it sounds like you joined the graduate scheme, but you already had all this wealth of domain knowledge and skills that come from the medical degree. Is it fair to say that it sounds like you progressed considerably, but then you were hitting your ceiling because of the limitations of, the promotion cycles or whatever it was, and that was generating a bit of frustration. Is that fair?
It's very good reading, Jing. Very good. I think in a traditional firm, there's a traditional pathway. I've alluded to it a few times in my youth and in patience. And so progression's always been important. I've always been looking for the next exciting big thing. And those things are always slightly out of my depths. And that's what's driven me to do cool, exciting things over time. And a big traditional consulting firm does not move in that agile or flexible a way. It has cycles. And, I was really lucky at Deloitte. They pushed it as far as they could for me, but it just wasn't quite far enough. And so I think the combination of wanting to work in healthcare and being impatient meant I just needed to make that shift.
So then talk me through the transition to Carnall Farrar, which is quite a different consulting firm.
So I came across CF at the time, 8 or 9 years ago. I lose track. It's been a while. And it was this specialist healthcare firm. And I was really attracted to that as a concept. I think what I was looking for was someone to learn from. I wanted experts around me who'd done things before that I could build off of and who would help coach, mentor, kind of expose me to new healthcare concepts. And it wasn't a generic consultancy. It wasn't me coming up with new concepts all by myself. It was about, what is best practice? What does great look like? And how can I build on that to kind of evolve for my clients? And so when I came across them, they seemed a bit too good to be true. And there were 2 kind of incredible female founders. And I think that was exciting for me as part of my journey as well, because, female leadership, there's not a lot in consultancy, and it's still a journey and we're still improving on it. But having 2 really bold, empowered ladies kind of leading the charge and becoming one of the most recognized healthcare consultancies, definitely within the NHS space, but across the UK at the moment, was really exciting. And so I looked at them and I was like, I want to be like you. I want to learn from you. I want to work with you. And what I loved about the CF way was the partners are actually involved in delivery. Mm-hmm. It's like core to our DNA. And so when we sell things, it's those same people who are delivering the work alongside the team. And that was a really great opportunity to learn. So I was just looking for experts in health that I could learn from. And I wasn't really sure about CF. It was a while ago, and I'd not heard of them before that stage. And so it was a bit of a risk going from a big established brand name to one I hadn't heard of. But I'm so glad I changed. I've absolutely loved it. Working for a female CEO has been really cool, and I've had that mentorship the whole time. And so I'm really lucky. And by fluke, I came across them because the lovely recruiter reached out to me at just the right moment. But I never looked back.
And you became a partner in a relatively short period of time. What did that take? What did that look like?
It's interesting. I've never really believed in tenure as a thing. I believe in experience. And one of the things I love about consulting is it's not about waiting for someone to retire or to leave to take their job. It's about creating the market, meeting the demand, and creating that space for yourself. And if you're passionate about something and you love something and you want to solve a challenge and it actually resonates with the market, with healthcare leaders, then someone needs to lead that. And that's what it means to be a partner. It's about really understanding what are the healthcare challenges and creating an offer that speaks to those challenges. And if it resonates, well, then people are going to follow. You're going to grow a team, and that team's going to have a leader. And that's what it is to be a partner. So I'm very lucky that CF invested in me in that development. I'm sure I've been a headache for many of my senior leadership team over that time. It was a great opportunity to just kind of to go for it and follow the things that I was passionate about. Turned out the company was passionate about those things too. And so at every step of the way, they've been clearing those roadblocks and helping me to create those offers that mean something in the market. And so, yes, it's a bit surreal to be a partner at a young age. It's spoken to kind of my need for growth and acceleration. Yeah, it's always met that. which is really exciting. But yes, it's been a great journey. And sometimes I look at the numbers and I think, oh, that is quite fast and that is a bit funny, but it's felt very natural. It's been very tiring to know that. But, it's been a good journey so far.
Of course, there's always trade-offs. There's always a price to pay. And you said that you were creating the opportunities, creating the market. So what exactly was that?
I think in healthcare, there's a lot of challenges that people face every day, whether they're clinical challenges, whether it's the waiting list challenges we face today, whether it's how to embed data and technology, how to use AI these days. Healthcare leaders are wrestling with all of these things, and the priorities shift over time. And the market is great at serving. So third parties are great at serving some of these needs. And then some of them, there are just real gaps, and the quality of what's being put out to help these healthcare leaders is absolutely rubbish. And so where you see something that you think you can help with, just having a conversation with those leaders saying, would this be useful, shaping that together and adding something that's creating value, that's always been the approach. And a lot of cool projects, many of which were under the leadership of other partners who were offering something to the market that was really useful. So whether that was, drivers of the deficit project, which I first started out, helping NHS balance its books effectively, or whether it's been like elective recovery strategies, getting the waiting list down, all of that stuff's really important. And sometimes it's just been the market's not been serving it very well. And so creating something that genuinely helps, I think, will always mean you grow. There's space for your leadership. It rewards you. You can grow a team in that space as well. And so that's how it's looked for me. And more recently, it's been under my own kind of banner as a partner and what I want to grow. But my very early stages, I started working under the fabulous partner team we have at CF. And so they showed me their projects, they shared their skills, they trained me up. And over time, I kind of created my own space as well.
Sounds like you had the role, but you were constantly spotting the opportunities. So in many ways, you were, very entrepreneurial, really strategic. And that's how you accelerated in your own career journey. And I'm guessing that same approach is what you took in coming to lead the Middle East practice. Can you just tell me a bit more about that?
Yes, that was an interesting one. I think I'm a person, I'm obviously Middle East and the name slightly gives me away. And so I'm always a person that's had one foot in the West and one foot in the Middle East. And it's a place I feel equally at home at. And so it's where I've always taken my holidays, it's just part of who I am. And so I was working at CF, which was predominantly a UK focused healthcare business, with the NHS being one of our largest clients. And we've obviously done international work. And after my second maternity leave, a potential client who we worked with in the NHS and who had relocated to the UAE kind of rang us up and said, I'd really like some help. And so we scoped a whole project with them. And I was slightly at a loose end after maternity leave, having literally just come back. And I thought, oh, this is really good fun. And we flew out to UAE and we had a great time exploring it. And we just thought, oh, maybe this has legs. Maybe we should do more than just do the odd project in the Middle East, but actually, what would it take to establish ourselves out here and go on a similar journey? What I loved about CF is they clear the roadblocks, they invest in the things that you're passionate about as long as it aligns with the mission. And so when I spoke to the team and said, I really want to do this, I want to pursue this Middle East thing, they've just backed it all the way. And so it's been a journey. I'm the CEO of the Middle East entity, which is a subsidiary of the bigger firm with our kind of global leadership. But it's been a lot of fun. So we headquartered in Saudi Arabia and we serve the whole of the GCC market from there. And Saudi is one of the biggest healthcare transformations around the globe. I think they're spending trillions. They've got loads of giga projects. The ambition, the scale of change is huge. And it's so exciting to be just a small part of that journey. And so absolutely love it. I go back and forth between the Middle East and the UK. And it's a bit crazy, my journey to kind of be leading this with a fabulous team. But it's a journey that I wouldn't have had that opportunity anywhere else. And so that's why I love CF. It's all about, what are you passionate about? What part of the healthcare market do you want to serve? And how do we make that happen? And it's all about impact. And that's what's created the chance for me to do this. So I'm having a lot of fun. But yes, still more tiredness because we got to run.
And I suppose, we've come very much to present day, and you are now the partner at CF, and you also lead on the Middle East practice. Well, how do you define success these days? And I guess, how has that changed over time for you?
I think the biggest change is having children. It changes your outlook on what you want to achieve in this world. I think if you'd asked me in my early career, it was all about progression and titles. And now it's all about what is the legacy? What is the impact you're having? What kind of world are you creating for your children? The ethics of what you're doing are so important. And healthcare is a human right. It's fundamental. Without healthcare, you cannot thrive. And it's not the only one. Obviously, education, food, there's so much safety to be had in the world. Global warming is really important. But for me, I've dedicated myself to healthcare. And so I look into my little boys and they completely changed what's important to me. I don't care about the titles, the progression, the promotions. It's just, they're nice to have, but they get a bit old. And actually, it's all about what difference have I made? And the thing that drew me to medicine was, saving lives, looking after patients, having that impact. And I've sort of gone full circle and I'm back to what kind of world do I want to create for my boys? And, I want them to be proud of me because there are sacrifices in all of these careers. You're not always around. You travel a lot, it's hard sometimes, but I want to create a better future for them and for all the children. And so for me, that's what's changed my motivation. And it's just about what is that impact and that legacy that I want to lead. And, having that impact every day is really important.
Wow. That is incredibly powerful. I don't have kids, so I'm looking forward to experiencing that epiphany myself.
Give it time.
And we're running out of time now, so I'm going to ask one final question. There'll be a lot of people listening to the show today, and they'll be considering their own careers and the possibility of moving into consulting. So is there any kind of practical advice you would give to students or clinicians that are looking to make the move?
They just do it. I think, you shouldn't be jumping from one career to the other because you're unhappy with the one that you have. You should jump because there's something that attracts you about the place that you're going. And maybe it's not the right fit. Maybe you need to try a few things to find the right fit. I don't think changing career is ever that much easier, that much better for hours or pay or any of the rest of it. It's about what gets you up in the morning. What do you find exciting? What kind of change impact do you want to have? And so consulting is not for everyone. I tell a lot of my clinical friends, I don't think this one's for you. But, if presenting to boards, driving change, dealing with people, really tough problems get you up in the morning, then I think it's a fabulous place to start. And just reach out to people and understand what is it like every day and see if you can see yourself in those kind of positions and then give it a go because no decision is permanent. Even if you're a practicing clinician now, you can always go back and try it again or take a different route. But if that's what makes you excited, then there's nothing to lose.
I think that's great advice. And we see a lot because so many people are unhappy in clinical practice today, but it can't be the push factors that motivate you. Otherwise, it's just not sustainable because the reality is, as you've said throughout this podcast, it's pretty tiring what you do, as it is quite tiring what I do as well. So, the grass is not always greener, but you need to be driven by a higher cause or by a value that that isn't being met in your current place. Brilliant.
Thank you so articulately.
Yeah, it just came to me in that moment. So that's all the time we have for today. Thank you for joining me, Zahra. And for all those who are listening, if you like what you hear and you want to support the show, please do like and subscribe to us on Apple Podcasts, Spotify, YouTube, or whatever podcast platform that you're currently listening to us on. It would mean a lot to me and it would really help us spread the message to others exploring alternative paths. Thank you for joining and see you next time. Bye-bye.